Hello guys, welcome to Agni Nursing Academy. So myself Sunil Uzi, I am the faculty of Agni Nursing Academy in the OBG subject. So here there are some very important MCQs are there. So we will discuss with all rationale with their concept. Understood? So here is the first question, that is uterus with the depression at the fundus is called. So option E is the arcuate uterus, and option B is the bicornuate uterus, and option C is the septate uterus, and option D is the uterus didelphus. So these all are the abnormal uterus we will see. Understood? So normally uterus is in the shape of pear shape. Understood? So this is the normal uterus. So this will connect the cervix and this will connect the vagina. Understood? So they are telling that, so depression at the fundus. So what is the name of this uterus, they are asking. Understood? So there are the various type of the uterine abnormalities we will see. So I will show the image of those all uterine abnormalities. First of all, I told, so this is the normal uterus. So you can see here dome shape of the fundus you can see, and so this is the body of the uterus in the pear shape, and this is the cervix and this is the vagina. Understood? So this is the normal in the structure of the uterus, and in this is the second image you are seeing, that is didelphus uterus. So what will happens means, the fundus of the uterus will unable to or failure to fusion completely. Understood? So here we can see the fundus of the uterus will goes inside or unable to failure. So again you can see this is the image third, that is bicornuate uterus. Almost these didelphus and bicornuate uterus are similar and same only, but here incomplete or partial incomplete or failure to fusion of the this fundus we will see. But in the didelphus image, full incomplete or in failure of the fusion of this fundus we can see. Understood? So both are almost similar. And so again you can see, so this is the image third, that is septate uterus. So here also partial incomplete or failure to fusion of this body of the uterus we will see, but the fundus of the uterus is fused, means normal in shape. Understood? So you can see in the septate uterus fundus is normal, but body of the uterus is like a two horn. Understood? So this is the major similarity between this didelphus and bicornuate and the septate uterus. So again you are seeing the image 4 here, that is arcuate uterus. Here the fundus of the uterus is means similar or normal only, but at the body of the uterus only somewhat depression we are seeing. So that is the arcuate uterus. And so again you are seeing the image of 5 here, that is unicornuate uterus. So here only one side horn we can see. Understood? Only one side of the horn of the uterus we can see, and failure to the second side or left side of the cornuate were absent here. Understood? So these are the various types of abnormal uterine cavity we will see in this case. Yes, sir. Come to the first question here. That is uterus with the depression at the fundus. Only they are telling that only depression at the fundus is present in the cases of the arcuate uterus. Understood? So option A is the correct answer for this question. So in the bicornuate uterus, so partial incomplete or failure of the fusion of body we will see, and in the septate uterus also same, means these all are the similarity only, somewhat difference is there, but in the arcuate uterus only at the fundus region is depression we will able to see. Understood? Yes, sir. So here is the second question, uterine pacemaker situated at the. So first of all, option we will see the option, that is option A is the cornua of uterus, and option B is the isthmus, and option C is the cervix, and option D is the body of uterus. So I will show you the image of the uterus here. So this is the fundus of the uterus, and this is the body of the uterus, and this is the interstitium and isthmus, ampulla. Understood? So these all are the fimbriae. Okay. So first of all, so this is the right side of uterus and this is left side of uterus. At the junction of this interstitium of the right side, the oxytocin receptors are more. Understood? Increases or more in the right side cornua of uterus or interstitium uterus. So mainly this contraction capacity will start or more in the right side of this cornua of uterus, and always contraction will start from this in the descending order only, means like that. So first in the right here, first in the right cornua of uterus, so then goes to the fundus, understood? So then fundus, and then fallopian tube, and then body of the uterus, body of uterus. So then goes to the cervix. So this is the descending order of the contraction capacity of uterus we will able to see in the cases of the labor. Okay, so you can see here in the descending order means the first corner of the uterus, then fundus, then fallopian tube, body of the uterus, cervix, vagina. Like that, a contraction will start from the upper body of the uterus to the lower body of the uterus, and so here to the lower segment of the uterus we will able to see. Okay, so mainly pacemaker of the uterus is present at the right cornua of the uterus we will able to see, means contraction capacity will start and more oxytocin receptors we will able to see in the cases of this region, that is right cornua of uterus, understood? So option A, cornua of the uterus. So that is also in the right side. Understood? So option A is the correct answer for this question. Understood? So one thing you remember, in the right corner of uterus is the main important pacemaker of the uterine cavity. Understood? Yes. We will see the next question, that is corpus cervix ratio up to 10 years of age. So they are telling the option we will be able to see here. Option A is the 3 is to 2, and option B is the 2 is to 1, and option C is the 1 is to 2, and option D is the 3 is to 1. So corpus means the uterus, understood? Corpus means uterus and cervix. They are telling the size. So right here, size of the cervix and uterus is vary at the different age style, understood? So for example, at birth and at up to the 10-year of age, and in the reproductive age, understood, and at the post-menopausal age, postmenopausal age. So these uterus and cervix length will be differentiated, understood? So that we will discuss here. At the birth, uterus size also and cervix size also same, means 1 is to 1, uterus size and cervix size. So you are seeing the image here, this is the uterus and this is the cervix, understood? The uterus body size and cervix size is almost similar at the birth size, understood? So at the birth, above the birth, up to the 10-year of age, so uterus size will be less and cervix size will be more, means 1 is to 2 we will able to see up to the age of 10-year. And sir, at the reproductive age, so it will reverse, means so that time uterus size will be more and cervix size will be 1, means 2 is to 1 we will see able to see in the cases of reproductive age. So again at the post menopausal age, means when the period will stop, after that again we will able to see 1 is to 1. And so this chart is very important right here, very important. So this question has been already arrived in the previous year exams, understood? So okay, again we will see here, at birth 1 is to 1, and at up to 10-year of age 1 is to 2, means cervix is more at the 10-year of age, and reproductive age uterus is more length because it have the capacity to able to hold the fetus, no? So that's why 2 is to 1, and again at the post menopausal age 1 is to 1. So these all are due to the hormonal imbalance, mainly estrogen, understood? Mainly estrogen will imbalance will there, no, in the reproductive age. So these all are the more we will able to see. So that's why this corpus cervix ratio will be, length of the ratio will be vary in the different age group, understood? So here option at the 10-year of age 1 is to 2, understood? 1 is to 2 is the correct answer for this question. Okay, So next question we will see here, that is fourth one. The following is the function of fallopian tube. The question is related to function of the fallopian tube. So option A is the secretion of estrogen and progesterone, and option B is the helps in fetal development, and option C is the act as a passage way for the fetus, and option D is the mobility of fertilized ovum. So one by one we will discuss here. Option A is the secretion of estrogen and progesterone. So no sir, fellow, this secretion of estrogen and progesterone is the work of the ovary. Understood? So the ovary will secrete the estrogen and progesterone. So this is also wrong one, and helps in the fetal development. No sir, fetal development will happen in the uterus, not in the fallopian tube. Understood? So this is also wrong answer. And option C, act as a passage way for the uterus. Sir, you can see here, fetus will be developed in the uterus. So and so this is cervix and vagina is the passage of the fetus, not the fallopian tube. Understood? So here cervix and vagina is the passageway for the fetus, not a fallopian tube. And so option D, so this is also wrong. And option D is the mobility of the fertilized ovum. Yes, this is the right answer for this question, sir. Why means we will discuss here. Mobility of the fertilized ovum. So here you can see, so this is the uterus. Understood? So here at the ampulla, the fertilization of the male sperm and female ovum will happens, and that procedure we'll call it as the fertilization. So this fertilized ovum at the 16 cell stage, we'll call it as the morula. Understood? 16 cell stage, or morula or blastocyst, we will call it as at the day of 5 to 6 day, means 5th or 6th day. So it will start from movement from the fallopian tube to the uterine cavity. Understood? So it will attach or implantation at the upper uterine segment at the posterior side of the uterus. Understood? So for that purpose, mobility of the fertilized ovum here, so here the fertilization of the ovum will take place, and here mobility means movement from the fallopian tube will happen. So for that, option D is the correct answer for this question. Understood? Yes sir. We'll move on to the next question, that is fifth one. So when is the best time to achieve a pregnancy? So they are telling when is the best time to achieve pregnancy. Understood? Option A is the midway between 7th to 8th day of the ovulation, and option B is the immediately after starting of the menses, and option C is the 14 days after the beginning of the next period, and option D is the 14 days before the next period is expected. So do comment in our comment box. We'll see. We'll give for the 5 to 10 seconds. So if you know the answer, please comment in our comment box. Okay. So don't confuse with this option C and D. Both are somewhat similar, they are saying. Understood? Yes, option C. So we'll discuss here. First of all, the menstrual cycle, normal menstrual cycle period will be at the 28 days in the normal woman. Understood? At the day of 14th, ovulation will happen. Understood? At the day of 14th day, ovulation we will able to see. Sir, one thing I will tell. So this second half of the cycle is the constant phase. This second half of the cycle is the always constant in page, means once the ovulation will happen, so definitely after 14 days the period will start, means day one of the period, next cycle will always start here only. Understood? But if the one female menstrual cycle is at the 35 days. Understood? So one female menstrual cycle normal days she will take 35 days, means so I will write here 35 days. So again here also in this second category of the female also, this second phase will be only 14 days only. So now minus 35 minus 14 is 121. But here first half of the cycle will be in that female is 21 days. Remember guys, always second phase of the menstrual cycle is whether it may the female menstrual cycle is of 28 days, 30 days, 35 days or 40 days, whether it may vary, but second half of the cycle will always 14 days only. So that's why we'll call it as the second half as a constant phase of the menstrual cycle. Understood? So always remember 14 days. Understood? 14 days before next period occurrence, no, so that time ovulation will happen. So that time ovum will be activate around 12 to 24 hours if intercourse happen between that male and female. So that time means before 14 days of the occurrence of next period. Understood? Next period. But here we can see in the 35 days 35 days menstrual cycle female, if we will tell after the 14 days of the initiation of the next period means it will wrong, because first half of the cycle is a not constant period. So you can see here option C is the 14 days after the beginning of next period. No sir, 14 days before the next period is expected. This is the right answer for this question here. Understood? Means today ovulation happens means after 14 days next period will be start. So this is the uh, constant phase. So that's why, so option D is the correct answer for this question. Okay. The next question we'll see here. After ovulation, the ovum remains viable for option A is the 1 to 6 hour, and option B is the 12 to 24 hours, and option C is the 24 to 36 hour, and option D is the 48 to 72 hours. So this is the very important hallmark question. Understood? So in the recent exam only the question is one, otherwise question will come about the ovum viability or the question will come about the sperm viability. Understood? So these both questions are very important, don't confuse. Okay, so in the previous exam only this question has been asked, so many of people has been confused and marked it as a wrong option. Okay, so always remember female ovum lifespan is a less, male sperm lifespan is a more. Remember, female viability of the ovum is a less and sperm viability is the more. So ovum viability period is 12 to 24 hours, but sperm viability period is 48 to 72 hours. Understood? So this is the only one day, this is 2 to 3 day. Understood? Female 1 day, male 2 to 3 day. Understood? So here option B is the right answer for this question. 12 to 24 hours is the viable period of the ovum. Understood? Yes sir. Next question you can see here. Fleeting abdominal pain due to the follicular bleeding causing peritoneal irritation is called. Option A is the corpus hemorrhagicum, option B is the Mittelschmerz, and option C is the corpus luteum, and option D is the corpus albicans. So you'll see here the question first, the fleeting abdominal pain. So they are telling that abdominal pain is there due to the follicular bleeding. Follicular means that is the mature Grappian follicle in the ovary and causing the peritoneal irritation. So what is the meaning of peritoneal? So the abdomen is covering by the one cavity. So that will call it as the peritoneal cavity. Understood? Abdomen is covered by one cavity, so that will call it as the peritoneal cavity. So it will cover all the abdominal organs. So for example, so here you can see here at the 14th day of the menstrual cycle ovulation will happen. Understood? Ovulation will happen. So on the day of ovulation, so this Grappian follicle will be start mature and it will release the egg. Understood? It will release the egg, and due to in the cases of this Grappian follicle maturation, so there is a due to release of the egg, so this breakdown of this Grappian follicle will happen. So after the breakdown of this Grappian follicle, so there is a leakage of, so there is a leakage of the some fluids and blood will come from that Grappian matured follicle. So that fluid and blood if in case come in touch with this peritoneal cavity, so it will start the irritation. So it will start irritation when this Rapian follicle rupture, fluid and blood will attach to that peritoneal cavity. Understood? So that pain we will call it as the Mittelschmerz pain. Understood? So everyone know that at the day of the ovulation on the 14th day, Mittelschmerz pain. So that for that pain, Mittelschmerz pain will call it as. But behind this pathology, just you know, understood? Why this Mittelschmerz pain will come means on the day of 14th day, ovulation will happen. So due to the rupture of that Grappian follicle, so there is a leakages of some fluid and bloods will come. So that fluid and blood will cause irritation to the peritoneal cavity. So this is very very important. So and here option B is the right answer for this question. Okay. Yes, sir. We'll move on to the next question, that is the increase in basal body temperature after ovulation is due to. So option A is the estrogen, option B is the progesterone, and option C is the LH luteinizing hormone, and option D is the gonadotropin releasing hormone. Understood? So here you can see the question is, the series of question is related to this ovulation only. On the day of 14th day, the ovulation will happen. So after that one, so immediate corpus luteum will be formed by that Grappian follicle. So this corpus luteum will start producing or secretion of the progesterone. Understood? So this progesterone will be increase the body temperature. Understood? At the 0.5 degrees Celsius to 1 degree Celsius will increase due to the increased progesterone serum level in the body. Understood? So, due to increase in the progesterone level in the maternal circulation, the basal body temperature will increase up to the 0.5 degrees Celsius to 1 degree Celsius. Understood? So here the option is the B. That is progesterone is the right answer for this question. Okay. Yes, we'll move on to the next question, that is fertilization of two ova released in a different menstrual cycle is known as. Option A is the superpetition, and option B is the superfecundation, and option C is the fetus papyraceus, and option D is the none of above. So here the question, the beautiful question is there about two concepts we need to take here, that is superpetition and superfecundation. So I will write here petition and the fecundation. That is superpetition and superfecundation. So if at the day of 14 ovulation, again ovulation will happen. So in that one, this egg will contact with the sperm, so it will call it as the fertilization. Understood? So if the fertilization will happen, means on the day of the ovulation, so many eggs, around 400 to 500 eggs will release, and millions of the sperm will release. Understood? So in that time, one egg will contact with one sperm. So this is the normal phenomenon. If sir, on the day of same menstrual cycle, one egg plus one sperm and another egg with another sperm, so if in touch with if it cause the fertilization of the double fertilization will happen in the same menstrual cycle. Understood? Only one menstrual cycle will happen, means so that will call it as the superfecundation. Understood? So don't confuse here, I will tell once again. In the only one menstrual cycle, double fertilization will happen, means two fertilization will happen, means so that will call it as the superfecundation. But in, for example, in the January month, one fertilization will happen, means fusion of the one egg and one sperm will related to, it will cause the fertilization in the month of January. Already pregnancy process will start, and again in the next, in the month of the February, again cycle will happen, ovulation will happen. So that time also, if the fertilization will happen, so that we will call it as the superfetation. So this is the very rarest case, rare and rarest case. So this is the superpetition is the very rare, most rarest case. But here I will tell, in the superfecundation only in the one menstrual cycle. But option B, that is superfetation is the more, means two menstrual cycle. Okay, so here you can see the fertilization of the two ova released in the different menstrual cycle. Different menstrual cycle means superfetation. Understood? So option A is the correct answer for this question. But you can see option is the correct answer, and option B is, that is superfecundation means only in the one menstrual cycle. Understood? Yes, sir. We'll move on to the next question, that is corpus luteum of the pregnancy is functionally active up to. So on the day of 14th day ovulation will happen. So from this Graphian follicle, rupture of the Graphian follicle will produce the corpus luteum. So this corpus luteum will start producing of the progesterone and all. So this progesterone will be more active in on the day of more peak, means peak on the 22nd day of menstrual cycle. Understood? So after 22nd day of the menstrual cycle, so it will start a depletion, means it will start the decreasing activity of this corpus luteum. So it will shed on the day of 28. So that will call it as the period. Understood? So this is the normal phenomena. And so if the on the day of 14th day fertilization happens, means pregnancy will start. So that time this corpus luteum will active up to the 10 to 12 week of the pregnancy. Understood? If fertilization not happen, means only active up to the day of 28. So you can see here, only active up to the day of 28. That is also peak on the 22nd day of the menstrual cycle. If pregnancy happens, fertilization happens on the day 14th, pregnancy will start the process. So that time this corpus luteum will be active up to the 10 to 12 week of the pregnancy. Why, sir? Please comment in our comment box. Okay. So here, why means, so the placenta will be fully produced or fully formed at the 10 to 12 week of pregnancy. Means up to the placenta complete formation. So this corpus luteum will be active up to the 10 to 12 week of the pregnancy. Okay. So here option A is the correct answer for this question. So sir, so normally corpus luteum will be set up on the day of 28th day of cycle, that is last day, and it will be peak on the 22nd day of the menstrual cycle. Okay. If pregnancy happens, it will continue up to the 10 to 12 week up to the fully formation or fully maturation of the placenta. Okay. So option A is the correct answer for this question. Yes, sir. We'll move on to the next question, that is an individual has the maximum number of oocyte. So when the individual will have the maximum number of the oocyte. So I will tell, sir, at the puberty. So at the puberty, 1 to 2 million oocyte will be present in the female. And sorry. At the puberty, only 4 to 5 lakh this oocytes will be present at the female, normal female. And so at the birth, so here 1 to 2 million oocytes will be present. Understood? So at the middle age, means at the 35 to 45 age, so again it will very less. So when these all follicles will empty, so that will called it as the menopause. Understood? So that condition will called it as the menopause, means after completion or after all depletion of this mature oocyte follicles. So that will call it as the menopause. So again you can see here at the 20 week of gestation, so when the female fetus is at the mother womb, so that time oocyte will be at the maximum number. Its maximum number, that is 6 to 7 million. Understood? So always remember, in the mother of the womb, the female fetus has its maximum number of oocytes, that is 6 to 7 million. When at the time of birth only remains 1 to 2 million, and at the up to puberty only. One second. At the this at the puberty, by the at the age of the puberty, that is around 12 to 13 year of age, only remains 4 to 5 lakh. Understood? Only 4 to 5 lakh. So that time also, every month 400 to 500 mature follicle will be start matures or rupture. So that time ovulation will happen. So when this all 4 to 5 lakh follicles will start depleting, so that condition we'll call it as the menopause. Understood? So this is the very important question, at option D is the correct answer for this question. Okay, yes, we'll move on to the next question, that is the correct sequence of development of puberty in girls. So comment, please comment, when is the puberty will start in the girls. As we'll see, the correct sequence of the development of puberty in the girls is option A is the telarchy, pubarchy, menarche, and option B is the pubarchy, menarche, telarchy, and option C is the menarche, pubarchy, telarchy, and option D is the telarchy, menarche, pubarchy. So what is the meaning of telarchy? So I will tell here. Telarchy means the breast bud development. Understood? Breast development we call it as the telarchy, and menarche means starting of the initiation, means first menstrual cycle, we'll call it as the menarche, and puberty means development of pubic hair and axillary hair. Pubic plus axillary hair, we'll call it as the puberty. Sure. So they normally series is telarchy, and after that puberty, and after that increase in the height of the female, and last one is menarche. So this is the series. So breast development will be first occur in the female secondary sexual character, and next one pubic hair and axillary growth development will happen. After that height of the female will increase. Okay, and last one first menstrual cycle will start, that is menarche. So this is the normal series in the secondary sexual characteristics development in the girls. Okay, so you can see here option A, that is telarchy first, the second one puberty, and third one is the menarche. Yes, so here option A is the correct answer for this question. So option A is the correct answer for this question. Okay, yes, we will move on to the next question, that is a 29-year female patient report the dyspareunia. What is the meaning of dyspareunia? So difficulty during the intercourse, we'll call it as the dyspareunia. And physical examination reveals pairs hair and introitus that admits two fingers. Means please consider here the 69-year female patient. 69-year female means a menopausal woman is there. During the intercourse, difficulty in the intercourse she having, and on physical examination sparse hair and introitus that admits only two fingers. Means first vaginal examination, only that two fingers will interest, that is admitting, and a pale dry vagina is there. Understood? So a dry vagina is there. Is there any infection chances is there? So please in comment a comment, is there any infection is there for the symptom of dry vagina and a pale vagina? And you can see the adult gerontology primary care nurse practitioner initial management is recommended to. What is the initial management of this female? So condition they are giving, that is the 69-year female is there, and dyspareunia is there, and on physical examination only two finger admitting into the vagina, and a pale vagina and a dry vagina we are seeing. Understood? Option A is the daily touching, and option B is the topical hormonal cream, and option C is the topical antibiotic cream, and option D is the topical antifungal cream. Okay. So here one thing I will tell related to these all four options. Uh, Daily touching. What is the meaning of touching means? So this is the irrigation into the uterine cavity. Irrigation of the uterine cavity will call it as the daily touching. Understood? So after this touching, normally pH of this vagina and female reproductive system is the acidic. So due to this acidic condition, infection is less in the female body. If so, this pH is goes to the basic. Understood? If this pH is goes to the more than 7, so it will lead to the increased risk of the infection. So by doing this Dutching, that female abdominal cavity or uterine cavity pH will be decreased. So pH will be more and it will leads to the this basic in nature. If basic goes means the infection risk is more, so that's why daily touching is not recommended in the female. Okay, so next sir, you can see here option C and D. This is the antibiotic cream and this is the antifungal cream. So here antibiotic cream when we will apply means if there is any risk of the infection means we will apply the antibiotic cream. So if she is having the anti infection means so there is a risk of chance of the fever, but here symptoms they are not telling that no fever spike is there means related to fever there is a no any signs and symptoms are there means there is a no infection is there in the female means this antibiotic cream also no need, so option C is the wrong one. And the last one, that is topical antifungal cream, so this is also not means so there is a no any signs and symptoms related to fungal infection here. So only one then only remaining option is that is topical hormonal cream. Topical hormonal cream is there, so that is the right answer for this question. So this hormonal cream will contains the estrogen. Estrogen cream will be applied on the post-menopausal women. So due to the menopausal women, after menopause estrogen in the female body will decrease, so it will start some symptoms related to this dry vagina and the pale vagina and the hot flushes. So these all are the symptoms we will able to see in the cases of this menopausal woman. So to avoid this friction or despair in a, so we will apply topical hormonal cream, that is also estrogen cream. Okay, so option B is the correct answer for this question. Yes, next question, a vaginal fistula that open in rectum is called. So the vagina fistula that open in the rectum, so option A is the vesico-vaginal fistula, and option B is the colo-vaginal fistula, and option C is the recto-vaginal fistula, and option D is the entero-vaginal fistula. So what is the meaning of this fistula means, for example you will see, so this is the vagina, so this will connect or this will create the another abnormal connection between the bladder. So for example, so this is the bladder, this is the urethra, so the abnormal connection between the bladder and the vagina will call it as the vesico-vaginal fistula. Understood? And colo-vaginal means the abnormal connection between this vagina and the colon, that is large intestine, will call it as the colo-vaginal fistula. And recto-vaginal means so abnormal connection between the vagina and the rectum, we'll call it as the recto-vaginal. Enterovaginal means enteric cavity and between the vaginal there is abnormal connection, we'll call it as the enterovaginal fistula. So these all are the abnormality we will able to see in the anomaly of the fetus. We can see here the we are showing the image, that is you know this is the recto-vaginal fistula, so you can see here, so this is the rectum, here the abnormal connection you are seeing, abnormal connection between this is the rectum. Okay, you can see here abnormal connection between the this vagina and rectum, so that will call it as the recto-vaginal. So here vesico-vaginal fistula means between this is the bladder, between bladder and this vagina there is the abnormal connection is there, so that will call it as the vesico-vaginal fistula. So and only two images are there, so these all are the fistula, that is abnormal connection. So here they are telling open in rectum means recto-vaginal fistula. Understood? Option C is the correct answer for this question. Okay, so we'll move on to the next question, that is condition in which the bleeding is so irregular and excessive that menses cannot be identified is known. So condition in which bleeding is so irregular means every month menstrual period will be irregular and excessive means more in amount or volume that menses cannot be identified is known as. So you can see here, I will tell the all abbreviations related to this menses. Menorrhagia means excessive period volume will called it as menorrhagia means normally 20 to 80 ml of the blood is the normal menses for the every month. If more than 80 ml we'll call it as the menorrhagia. Answer, metrorrhagia means irregular period we'll call it as the metrorrhagia. Understood? Means every cycle will contains the 28 days. So if cycle is means less than 28 days, 14 days, 20 days, 28 days, so that time means cycles will be at the irregular in period, and so that will call it as the metrorrhagia. And polymenorrhea means so more in, sorry, more in the cycles means, for example, we will consider there is a 12 months in the year is there, but every month one cycle you will consider. For example, for 1 year you consider 12 12 menstrual cycle, so this is the normal. But in the polymenorrhea what will happens means, so there is a normal cycle is 28, but here the cycle will be only 20. If 20 means, so there is a occurrence of 14 to 15 cycle will happens in the only 1 year, so that condition will call it as the polymenorrhea. So here the cycle span is less means only reduced to 28 to 20. 20 means for the every uh, 2 month means 2 month contains the 60 month. In that within the 2 month 3 cycles will happen. Understood? So automatically the menses cycle will be more. So that will call it as the polymenorrhea. And here the D option, that is menometrorrhagia. Meno means menorrhagia means excessive in the volume. Metrorrhagia means irregular in cycle. Understood? Menometrorrhagia means excessive in volume and irregular. Metrorrhagia means irregular in cycle. So option D is the correct answer for this question. Option D is the correct answer for this question because the question contains both, that is irregular also there and excessive in amount also there. If the question asked only irregular menstrual cycle means, so that will call it as the metrorrhagia. But the question asked about the excessive aluminum, so that will call it as the menorrhagia. But here the question is telling that both irregular and excessive, so that will call it as the menometrorrhagia. So these are all the very important concept till now have discussed related to this OBS and gynae. So in the next upcoming classes also we'll discuss the very important beautiful concepts. Understood? So again, our Agni Nursing Academy will providing the very important Agni test series. Understood? Agni test series for the this NORCET-10. We are providing the daily Agni test series for the NORCET-10. So these consist of the same as like the NORCET pattern only. So it is contains the 5 sections and each section contains the 20 questions. So this is the real time exam will feel in our test series. So please download our Agni Nursing Academy app. So you will enroll for that Agni series. Understood? So this is the very important questions, and this test will be prepared by the expert team only. Okay. So thank you everyone. We'll meet in the next session.